Good afternoon and welcome to the daily briefing here at St. Clair County EMA. Once again joined with Chairman Mark Kern and Sam Behrman from the Health Department. Sam, you have some numbers for us today, and as always, we appreciate you being here with us.
Oh, absolutely. We're happy to be here. So as of today, 5,070 St. Clair County residents have been tested for COVID-19, and we are reporting 905 positive test results today, which is an increase of 13 from yesterday. And that includes both males and females from their 30s up to their 70s. We are at 4,077 negative test results, with 88 still pending. And I'm happy to announce that we have no additional deaths to announce today. So always a good thing. And that total remains at 69. And we are at 501 that have completed their IDPH required 14-day quarantine. For state totals, we are at 684 that have been tested, with 98,030 positive test results, which is an increase of 1,545 from yesterday. And unfortunately, we are reporting some new deaths for the state today. We are at 4,379 for a total, and that is an increase of 145 from yesterday. And as always, our condolences go out to those families who have lost loved ones to COVID-19. Hospitalization numbers, and these are for hospitals that are in St. Clair County. We are at 62 patients that are admitted due to COVID-related reasons, and 3 of them are on ventilators. Congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms. Brea of Belleville has 23 cases and 2 deaths. Brea of Cahokia has 8 cases and no deaths. Caritas Family Solutions in Belleville has 18 cases and no deaths. Colonnade Senior Living in O'Fallon has 5 cases and no deaths. Four Fountains in Belleville has 109 cases and 17 deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville has 6 cases and no deaths. Lebanon Care Center in Lebanon has 51 cases and 9 deaths. Memorial Care Center in Belleville has 43 cases and 5 deaths. And a new addition to our list today, New Athens Home for the Aged is at 4 cases and no deaths. St. Paul's Home in Belleville is at 10 cases and 3 deaths. Swansea Rehab and Care Center is at 4 cases and no deaths. And finally, TDL Incorporated in Belleville is at 4 cases and no deaths. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. So looks like we've gone up about 10 with COVID-19 patients in the hospital. So we got to remember, if we're going to move into phase 3, we got to keep these numbers at least consistent, if not rolling downwards. So let's just continue to remember we gotta just stick with this thing, and hopefully we'll get to that level where we move into the next phase. And
the past couple of days we've been happy with the way our numbers are looking and are coming. So we have to just keep doing what we're doing and see that light at the end of the tunnel.
Great, thank you. So we'll move into the zip codes right now. In 62201, they remain constant at 13. 62203, we now have 29. That's an increase of 1. In 62204, we now have 35 COVID-19 diagnosed patients, or people, with an increase of 1. In 62205, we actually saw a decrease of 3 to 39. And as we said, sometimes these numbers with the state, with ours, people check out, you find out they actually lived in a different zip code than where they were registered when they were in the hospital. A lot of different reasons for a decrease. It's rare, but it happens. And so today in 62205, we're now at 39. That's a decrease of 3. In 62206, we have an increase of 5 to 83. 62207, we have an increase of 3 to 58. 62208, we have an increase of 2 to 51. In 62220, we're now at 98. That's an increase of 4. 62221, we're now at 78. That's an increase of 1. 62223, we're at 44. 62226, we remain at 110. 62232, we remain at 15. 62239, we remain at 11. We have a new zip code today to add. 62243 now reports 6 COVID positive people in that zip code. 62254, we now have 28. That's an increase of 2. 62257, we now have 7. That's a decrease of 1. 62258, we have 14. 62269, we now have 62. That's an increase of 1. And 62285, we remain static at 7. So the zip codes, a lot of changes today. Let's just keep doing what we're doing. Stay 6 feet apart, wear your masks, social distance, and let's also remember to be kind to each other. Let's remember to call the neighbors, the friends, the relatives who might not be hearing from people, might be a little lonely. Let's make sure we reach out to them so that their day's a little bit brighter during these tough times. At this time, we'd like to welcome to our program Dr. Maria Scarborough. Maria is an emergency room physician at Memorial Hospital.
Yes, thank you for having me.
Thanks for being here today. So, Maria, let's talk a little bit. How are things looking in the emergency room? I think we talked a little bit earlier. You said things seem to be pretty steady.
They've been very steady. We're seeing a steady flow of patients coming through the ER that are highly suspicious for COVID for about 3 to 4 weeks now. So we are well prepared for them, and we're treating them accordingly.
So, being in the emergency room, you see, everything come in there. But are you experiencing people maybe deciding, hey, I might have a stroke, but I don't want to catch COVID by going to the hospital or a heart attack? Can you talk about that a little bit?
Very much so. I'm hearing a lot of stories from the community of people that are having a lot of chest pain type symptoms that are not coming to the ER because they're scared of COVID. But I can only reassure everybody that it is very safe to come into the hospital. We are prepared from the moment that they hit the door to separate the patients that are COVID suspect from the ones that are not. So we have all capacities available to treat everybody, including those with cardiac symptoms. So please don't stay at home if you have any concerns. You definitely need to come see us in the ER.
So let's talk about how they're protected, how they're segregated from a COVID patient. So if I'm having chest pains and I get put in an ambulance, I'm taken to the hospital, am I treated differently than a COVID-19 patient?
You get the same high level of care.
Okay.
However, the moment that you come into the ER, we have actually the ER Memorial split into 2 areas. So the patients that are COVID are on one side, and the patients that are likely not COVID go to the other side. So you're physically separated from those patients.
What about the airflow? Are the HVA systems separated also?
I don't know about the central hospital systems, but I know that in the rooms that the patients with concern for COVID go into, that there are negative pressure systems in place, so that air is kept away from. So I believe that is immediately transmitted out of the hospital, from what I've heard.
So you've been with this since the beginning, right? And has your method of treating a COVID patient changed since March or whenever
Very
your
much
first
so.
patient?
Very much so. It's mostly treating the critical patients, which we're not seeing anywhere near as many critical patients as we did in the beginning. But I think part of that was our treatment. We tended to be a lot more aggressive in the beginning. We kind of followed the practices out of Italy, which said that if they have an oxygen requirement of greater than 6 liters, they would get intubated, which means put on the ventilator, much quicker than we do now. We found that they weren't having good outcomes. So I think that's partly why our mortality numbers have improved. And that's also why our ICU is more open than it was in the beginning.
So let's so instead of intubating a patient early on, you wait. You're still intubating
Sure.
patients.
Sure.
So what's the alternative then?
High flow oxygen, or even a mask, a CPAP mask to help them breathe easier.
And so high flow oxygen means you're. What does that mean?
It just means, so instead of just a normal flow of oxygen, it's high flow. And you obviously still keep them isolated from everybody else.
Any new medications that are being administered or new ways of?
Not locally. There's just not enough research out there to really support starting those medications quite yet. So
Has Memorial received the remdesivir?
I do not know that.
So you don't know of
No.
any patients that are?
No, that would be a good question for the ICU doctors.
Okay, well, I'll remember that
Yes.
when we have an ICU doctor. So as we talk about the numbers and we want to move into phase 3, according to the plan, and I think it's a stage plan that is put together by medical professionals. Tell us what that's going to look like. So Now that we move into a new phase, what's the purpose of a mask?
Sure. Well, in the beginning, I was definitely kind of reluctant to believe that this was our new reality, but I think that this is definitely something that's going to be around for at least a year or two. So it's important that we start practicing all of these daily activities now. Wearing a mask out in public is important because while you might not have symptoms, as you cough or sneeze, well, then you'd have symptoms, but people that don't wear masks tend to be coughing and sneezing, and then that puts it into the air. But most importantly, when it goes into the air, then it becomes droplet and will land on surfaces like what you're going to buy at the grocery store. So then when other people pick up that item, then they accidentally touch their face. So the first purpose is to keep it from getting transmitted into the air. And the second purpose, most importantly, is so that you're not touching your face. So that when you're out in public and you're picking things up and then you don't realize how often you touch your face. And then also I see people with gloves on a lot, and that's helpful, but then you also have to wash your hands afterwards. So you can still transmit it wearing gloves. I see a lot of people wearing gloves, but still kind of following the same bad behaviors that they would without the gloves on. So it's almost better to wear your mask, but then also a lot of hand washing. So as soon as you leave any store, either hand sanitizer or hand washing. I actually have a bottle of hand sanitizer in my car. So as soon as I get to my car, I hand sanitize so I'm not spreading it. Because that's the way that it's transmitted mostly, is through surfaces.
So that's the purpose of the mask. If you're in the grocery store, you think the chances, if you're doing everything you're supposed to, you're wearing your mask, your chances are low?
Pretty low. I'm in the ER. I'm around it all the time. I've been in the middle of a family of COVID patients. And as long as you're wearing your mask and you're doing appropriate hand washing and not touching your face, you don't get it. I haven't gotten it. So I don't want people to be scared of this. Obviously, we have to take our precautions. But I know there's a lot of people out there that have a lot of anxiety and a lot of fear about this. And if you go about your daily life and listen to the CDC and follow the recommendations, you are safe. This isn't a magic virus that's gonna fly in around your mask into your airway. You will be protected.
So you've got a great attitude. You talk about fear and anxiety. I don't see any anxiety, even though you've been dealing with this for a long time now. How's everyone else? Are they coping? Your fellow workers?
Yeah. I think it helps that we're exposed to it. We see the majority of the patients that we see are okay. They have flu-like symptoms and we send them home. So I think that exposure versus really not knowing helps us feel comfortable with it. And also knowing that we haven't gotten it, that we've been around these patients and that following those precautions have protected us. So, if I could get that message out there to everybody as well. Yes, this is a virus and it's dangerous, but it's not something to really internalize, and because I am seeing a lot of patients with a lot of increased anxiety as well, a lot of patients that have been more intoxicated lately than they might normally be. So I think that we need to use this as our new normal and go out there and live our lives.
So there are a lot of social ills that I think are going to come out of this.
Absolutely.
That we will see.
Yeah, we're already seeing it. We need each other. We need to go about our daily lives and do so safely.
And remember that the emergency room is available.
It is a safe place to come see us, yes.
Great.
Any hour of the day.
And if someone's having stroke symptoms, really, it's important to get to the emergency room
As soon as possible. I see a lot of patients who have had symptoms, slurred speech, droop, facial droop, weakness, and they wait hours to come in. Come in immediately. The sooner the better.
Great. Well, we appreciate you being here.
Thank you.
Herb, have you got anything?
Yeah, just a couple of follow-ups, Doctor. And I hear what you're saying. We need to move on with our daily lives, and I think that's being echoed by everybody, the people who follow our page. I hear that all the time. But there are some of our elderly and even some middle-aged people. When this first came out, it was said it was only attacking people 65 and older.
Right.
And we've got cases now that's 20, 30 years old.
Sure.
So there is a range of age there that can affect. But as long as they go out there and practice social distancing, they should be okay. Is that what I'm hearing?
I would agree with that. If you are older, 65 or older, I would be a little bit more cautious. I wouldn't be going into a lot of public situations. I would definitely, because the death rates are so much higher when you are older. Yes, it's safe to go out and get your groceries and maybe see family members and apply those social distancing rules, but I would be a little bit more conscientious if you're older or have health problems.
And we talked about this a little earlier. If I'm in the grocery store and I'm passing you in the aisleway, I mean, and if I've got my mask on, we're safe.
Yes.
Okay.
Yes, it's okay to smile and and keep walking. You don't have to act like they're infected, going to infect you.
Okay, good. And, we got early into this and the precautions that was taken. Do you feel that the early precautions that the state and the county has done, how has that played out in this?
Yes, I think that everything that we have done so far has been very necessary and has allowed the hospitals to prepare. Memorial Hospital, St. Elizabeth's Hospital, all the St. Louis hospitals are ready, and that gave us that opportunity to do it, to get all the tools that we needed to learn more about the virus. But then also, in the society, this virus is pretty contagious. While it's not going to get spread through the air, it does get spread, just like the flu, pretty easily through families and people who know each other. So that social distancing was pivotal. We would have been overwhelmed if we would not have done what we've done so far. All of the hospital systems in the area would have definitely been overwhelmed. So now we're ready.
And as the chairman said, as long as, people use some common sense, practice that social distancing, like you said, wash your hands. If everybody follows that, then we can open up into these other phases a lot sooner, hopefully, and we can start living a little bit back to normal.
I agree completely.
Very
I think
good.
that if everybody followed those rules, had masks on, lots of hand washing, kept the distance, there's no reason why we couldn't go back to normal as soon as we'd be allowed to do it.
Very good. Thank you, Doctor. We appreciate
Thank
you
you
coming
very
down.
much.
I
We
appreciate
appreciate
it.
you being
here.
Thank you.
Great. So, as many of you heard yesterday, it was announced that St. Clair County has been named as one of 2 counties, I believe, in the state to do a pilot program on tracing and tracking people who have been deemed positive or been diagnosed positive with COVID-19. And so today, Barb Holt is here. Barb hasn't been here for a while. Barb, though, is the head of the St. Clair County Health Department. Barb, welcome back.
Thank you. It's great to be back, sir.
And
Great to be
when you
back.
come back, you bring good news.
I do bring good news, and as you said earlier, I'm going to talk about testing. And first of all, I want to reach out and say testing is an incredible tool that medicine has used for years and years. And one of the reasons that I was gone for a long time, I did my annual testing, and I want to encourage everyone to do that because I did my annual mammogram and found out that I had breast cancer, and that's why I've been gone. But without that routine testing, I might have not known, and who knows what would happen. So that's why I want to talk about testing today, sir. So with this grant that we received, St. Clair County was the southern county that received it from the state of Illinois, and Lake County is a sister agency up north that received this grant as a pilot study to look at what else do we need to enhance COVID, the prevention of the spread of COVID within our community. So as we talked about earlier, we have several COVID testing sites throughout the county. We encourage people to get tested. That way, it can tell us 2 things. Obviously, it can tell you if you're positive, and then what will happen is we will follow up with individuals, and local health departments do this, with positive cases. We would call you, and this is kind of how the scenario would go. Let's say if you had tested positive, one of our health professionals would call you and say, hey, we have a medical report saying you've been positive for COVID, and we would give information on how to take care of yourself, how are you feeling, take your temperature on a routine basis. But then we would also ask for your close contacts. And the reason for that is this virus is very contagious. As the doctor said earlier, it's tough, and it's easy to transmit to others, especially if you're in close contact with you. You're within that 6 foot of social distancing. So we would ask you, who have you been in contact with within 6 foot for the last 3 days for, say, 10 minutes or more? And we will follow up with those contacts because by public health law, they're considered contacts to you, and they're required to be quarantined for 14 days.
But those contacts will not be aware who the person was they were in contact with. So you will keep that information private. You'll just tell those contacts, hey, you were near someone who had COVID-19, and then you make them aware of what precautions to take.
That's absolutely correct. Per all the HIPAA and privacy rules, we would say let's say we were in close contact, and the professional would call me and say, "Hey, you've been in close contact with someone that's been exposed to COVID." They never reveal the name of who it is or hints, or they may ask and things, but it's private information. We never reveal that. And we would have them on quarantine as well for 14 days. And then for both the cases and the contacts, our professional staff call on a routine basis to make sure, how's your temperature today, how are you feeling, how are things going, and ensuring that, again, when you're isolated or quarantined, you're supposed to stay home. And that's public law, and that is how we can prevent this COVID virus from spreading into the community. That's the secret to it, of this social distancing and testing and isolation and quarantine, so we can knock it out and get it under control.
So the purpose for your phone call, and we need to address some misinformation out there.
Mm-hmm.
So currently, you're doing this in St. Clair County. How many tracers do you have?
Right now we have 9 nurses that have typically other jobs that they're doing within the agency. We've pulled all forces to these essential priority health services of doing contact tracing. We have 9 nurses doing that, and as on a typical day, we're following up with 300 plus people. It just depends. We don't call people every single day, but we do phone call them to see how they're doing, the cases and the contacts. Some cases may have just their household members, and it's one phone call, and you may talk to 3 people, where other cases may have been in contact with 20 different people. So now we have the case and then 20 different phone calls. So it depends. If most people have been following the rules and sheltering in place, staying at home, most of the contacts are household members.
So this plan then that we are piloting, they're building on a system you've already built,
Mm-hmm.
and the connections you've already made with the local hospitals, the nursing homes, the caregivers, and then the public, and using your existing staff. So this grant that's coming, you don't track cell phones.
No, one of the things that they're proposing, it's an option for individuals if you want to be tracked on your cell phone. There's an app that you can put on your phone that we can track you that way. It's an option people have, and majority of the folks, and what we've heard so far, is they would rather prefer to be called, and we will do that. The testing is very important, and one of the things I want to emphasize, let's say you test negative. That doesn't mean negativity, doesn't mean immunity. It does not. You could test negative today, but in 3 days you may come positive. The test only works when you typically have symptoms and when the virus is starting to shed within your body. So just because you test negative doesn't mean you can go out without a mask or not practice social distancing.
So the reason for the grant then is that according to our population in St. Clair County, we need many times the number of tracers than we currently have. And so you'll be reaching out, looking forward to people applying for these positions. Is there a website that they can go to?
Yes, how they can do that. We're getting the details. We don't even have the grant in our hands, but we know it's coming from the Department of Public Health, and you can apply, and health departments across Illinois, not only St. Clair County, we have a special pilot grant to go out and do a little bit more what we can for our community and our region, but local health departments across the state of Illinois, Madison, St. Clair, Monroe, Eastside Health District, all be looking for contact tracers, and you can go to the Department of Public Health's website, which is dph.illinois.gov/COVID-19. And it's right on the front page, and it says COVID contact tracers, and you can fill out that form for no matter which county you live in, and then they can be separated. When we get to the point where we're able to start hiring folks, we can go through those listings, and typically we need folks that are kind of like me, have the gift of gab, be able to talk to folks, but understand that you're talking to people through a phone, and have very good communication and listening skills. Are they coughing? Does it sound like they're labored breathing? Those kinds of things, as well as just good interpersonal skills.
But there's nothing involved in this that people are scared that you're gonna be reporting things to the police and saying, well, they said they were at some place that wasn't following the guidelines. That isn't the purpose of this. The purpose is to find people who may have it and keep them home and away from the general population.
That's absolutely correct. It's completely, again, we will not be tracking your cell phones. If you choose for us to call you on your cell phone and you would text messaging and that's how you want to communicate, that is fine. If you don't, we will follow up with you on a regular cell phone call, but we don't attach a tracker to your cell phone when we call you.
Barb, let's talk a little Eastside Health District. I know Liz Patton's passionate about this. They're going to be doing virtually the same thing.
Absolutely, they are now. Again, we've been doing contact tracing since our first positive case back in March, and so has Eastside Health District. I think their first case came a little bit later on, but everybody's been doing this, and we've been shuffling staff from the rest of our programs to be able to cover this. Well, once the businesses and the doors start opening as we move into phase 3, we need to go back to those regular jobs that we're doing and offering the immunizations and the other services to the community. That's why we're going to need these contact tracers, and this may go on for 6 months, 9 months, a year, 2 years. We don't know. If we can really get enough people tested to show that we can, whoever is positive, we can pull them out of the general population to help control the spread of the disease, the sooner the better.
And people don't need a reason to get tested unless they go to Memorial. I think Memorial may have or the BJC Center in Swansea may still have a limitation, but all the other spots say, come get tested, and it's free.
Correct. It's free. They may ask you for your insurance. If you have insurance, that's fine. If not, it's free. Then typically the turnaround time depends where you go, anywhere from 3 to 7 days that you may get a test result back. There's a few that have a quicker turnaround time. It's a different kind of test, but all those testing sites are available on our health department website. Right on the front page, St. Clair County Health Department, just Google it. Testing sites are right there, and their times of operation and all.
Thank you, Barb. Well, is there Herb?
Yes,
what
sir.
else we got? Herb's
Barb.
always got something.
Hi, Herb.
It's great to have you back.
It's wonderful
And we
to be back.
personally want to thank you for leaving us in good hands with Sam.
Absolutely.
She's done
Thank you, Sam.
Done an excellent job, and
Yes.
she's kept us sane every day, believe me. But we're glad you're back in good health, and we appreciate everything you're doing.
Thank you. Thank you,
you.
guys. It's great to be back.
Good. On the EMA side, we had our conference call this morning with the local mayors. We always look forward to keeping them updated. Chairman, I think that was a good call this morning, and they've been hanging in there with us each and every day, and we can't thank them enough. Also, our call with the police chiefs and fire chiefs went good this morning. We should have some of the PPEs coming in hopefully tomorrow. I think Sam got notification that she's getting a pretty good shipment tomorrow, so she was smiling earlier. So I know some of the long-term healthcare facilities will be happy to hear that. I think that we were good news today, no deaths in the county. That's always great news. Of course, 145 deaths throughout the state. One question we had come in on Sunday, for those of you who follow us, you remember one person wanted to know if they could track the virus through the years. We didn't ask the doctor that on camera. I forgot about it, but I remembered, and she said, no, you cannot. So for the person who asked that question on Sunday, that's your answer, and you're hearing that from the ER doctor say, no, you don't catch it through your ears. So we appreciate that. Again, every day we're here. 3:30, we'll be back tomorrow, bringing you the latest information. You heard Barb Holt talking about this new program, and we're moving forward. You heard the doctor say practice good social distancing, personal hygiene, and we're going to get through this. We'll be back shortly with Daisy and Cindy to transfer this into our Spanish community, and we'll see you back here tomorrow at 3:30 for the next briefing. Thank you.